Good afternoon. Welcome to day 298 at the EMA office. Joined with Chairman Kern and Sam Bierman from the Health Department, where we try to keep you updated on the latest. And as we've said before, it's changing by the minute sometimes, right, Sam?
It is, and we do have some obviously new numbers today, but we have some new information regarding vaccinations as well. So once we get done with numbers, we'll move into the vaccination information. As of today, 214,472 St. Clair County residents have been tested, which is an increase of 1,436 from yesterday. We are at 21,926 positive test results, which is an increase of 225 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 15.7%. And we are at 192,546 negative test results. Unfortunately, we are announcing 4 additional deaths, which does bring our total for St. Clair County to 340. We had a male in his 70s who had underlying health conditions, a male in his 70s, a female in her 80s, and a female in her 90s, all with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 19,695. For state totals, 13,617,454 have been tested, with 991,719 positive test results, which is an increase of 6,839 from yesterday. And for deaths, the state is reporting 16,959, which is an increase of 126 from yesterday. For hospitalizations in St. Clair County, currently we have 117 patients that are admitted due to COVID-related reasons, and 11 of them are on ventilators. And regionally, we have 193 patients that are admitted due to COVID-related reasons, and 16 of them are on ventilators. For our congregate living facilities that are currently or previously been in outbreak status, please remember that these numbers are cumulative and we will only announce any facilities that have had changes. Colonnade of O'Fallon has 16 cases and no deaths, and that is an increase of 10 cases for that facility. Integrity Healthcare of Belleville has 81 cases and 2 deaths, and that is an increase of 2 cases for that facility. Knollwood Retirement Center in Caseyville has 12 cases and 1 death, and that is an increase of 1 case for that facility. Mercy Rehab and Care Center in Swansea has 123 cases and 11 deaths, and that is an increase of 2 cases. And St. Paul's Home has 145 cases and 23 deaths, and that is an increase of 2 cases and 3 deaths for that facility. So yesterday we had talked about our tier system when it comes to our vaccination process that IDPH and us as a local health department will roll out. There were some questions yesterday about one of our specific age gaps that was missing from the vaccination plan itself. We are waiting for clarification from the state for that. Version 4.0 is what came out this past weekend, and on a call this morning we heard that version 4.1 will be coming out at the end of the week. So not only are we hoping to have some clarification on that age range, but we're also looking at getting some more clarification on the 1B category, hopefully prioritizing that and getting just that broken down a little more.
And the state continues to send vaccine to
correct.
St. Clair County, so
Yes.
more doses are coming every day, but we are still in the 1A category.
Yes, and we will be for quite some time. You have to think that 1A category encompasses all medical professionals in St. Clair County. So that's dentists, orthodontists, oral surgeons, chiropractors. That's a lot of medical staff that we have to get through. So it will take us some time, but please be patient. We have had plans in place for quite some time. We are working with the state to perfect those plans, and a lot of it depends on what we are allocated. As we talked about yesterday, the state gets a certain amount and then they allocate it out to each county. So we really don't have any control over that, but we'll be ready for it when it comes our way. And as you said, we did have some deliveries of vaccine that made it to the hospital this week already. So we are happy to hear that and happy that they're able to get those vaccines out into the staff.
Great, Sam. Well, we'll go into the zip code report at this time. 62201, up 1 to 461. 62203, up 2 to 521. 62204 up 3 to 328. 62205 up 3 to 524. 62206 up 3 to 1,039. 62208 up 9 to 1,256. 62220 up 8 to 1,504. 62221 up 11 to 2,088. 62223 up 6 to 1,319. 62225 up 1 to 106. 62226 up 28 to 2,374. 62232 up 7 to 701. 62239 up 3 to 340. 62240 up 2 to 110. 62243 up 12 to 554. 62254 up 2 to 628. 62257 up 3 to 248. 62258 up 7 to 790. 62260 up 3 to 544. 62264 up 4 to 255. 62269 up 15 to 2,421. 62282 up 1 to 47. And 62285 up 2 to 419. 225 new people testing positive in St. Clair County today out of 1,436 tested, brings our positivity rate up to 15.7%, which then brings our 7-day rolling average up to 14.6%. The regional positivity, this is how the state views us in a region, is down today to 13%. Part of the region are the members of the region. Bond County comes in at 23.9%, Clinton 14.6%, Madison 13.2%, Monroe 21.2%, Randolph 17.4%, St. Clair 12%, and Washington County 38%. So the rates just continue to grow, Herb. A lot of deaths today. It seems like Groundhog Day. Now we're waiting for vaccine. I remember some 290 days ago when we were waiting for masks and hand sanitizer and gloves and all of those items. Now the waiting process is vaccine.
Well, and I know there are some of our Team St. Clair members out there that think that we're that old broken record. We keep saying the same thing, Groundhog Day. It seems like, unfortunately, we don't have, as Sam said, we don't have control over the shipment, the supply of the vaccine. But, I can assure you that when it gets here, it's being used. It's not sitting on a shelf somewhere, and I think Sam can attest to that.
And the reason for washing your hands, watching your social distance, and wearing the mask, this vaccine it doesn't cure it if you already have the virus. And now we're finding in Great Britain, South Africa, this virus is morphing into something new. And we want to make sure that we eradicate the virus before it has a chance to get stronger and better at what it does. It's important that we isolate this germ, get it contained, and get rid of it. The longer this goes on, the more chance that this becomes a even greater medical problem that we have to solve. So that's why we're on this every day. That's why we come here. And day 298, we're saying the same things basically that we said in day 1. Wash your hands, watch your social distance, wear your mask, and let's get this virus isolated and out of here.
Well, and that's the important thing that I think people forget about it. This isn't just happening in St. Clair County or in our region or in the state. It's happening around the globe. We're worried about another strain, as you just said, in Britain and South Africa that could all affect what we've been doing for the last 298 days. We monitor all of those reports that come in from the health departments. I know the health department is on top of that every day, trying to stay up with all of that. One of the best things now, Team St. Clair members and anybody, as these vaccines become available and they start rolling out, we're developing all kinds of ways to try to get that word out. So one of the best ways is through our Code Red system, that through the help of the county, we were fortunate last year to get that put in place. So if you haven't signed up for the Code Red emergency alert system, you need to do so, and you can do that. We'll put it up on the screen, but it's alert.stclair.com. It's real easy to sign up, and as that vaccine becomes available in those tiers, those age groups, we will be blasting those out periodically. So that's going to be another way, as well as here on the daily briefings and in the media. The health department will make sure that that information is getting out. So I strongly recommend you go in and sign up for that Code Red, not only for this, but it's good in case of any type of emergency situations we have in the county, or for general information warnings such as this.
And share the information.
Yes.
You know, early on, we talked about contact your neighbors, people need socialization. If there's someone you think that may not have access to Code Red or access to the ability to be on Code Red or access to the internet, just tell them, hey, you know, the vaccine's coming soon, you're in 1B, you're 75 years or older. Those type of things, I think, really can help to get people out so we can get them vaccinated and then move on to the next, to the 1C level, and then to 2, which then includes the general population.
And if you're having trouble getting signed up for the Code Red, call us here at the EMA office and we'll have somebody walk you through that process, because we want to get as many people signed up as possible so we can have that avenue of reaching out to let people know when this vaccine is going to be available. You know, we talked about, you know, there's 102 counties, I think, in the state of Illinois that is, everybody's trying to get that vaccine for their county. So it's just not like it's right here in St. Clair County that has to be worried about it.
But in St. Clair County, since we are the medical center of Southern Illinois, or one of the medical centers of Southern Illinois, we have 3 hospitals. We have a bigger 1A than a lot of other counties. Some counties don't have hospitals, don't have the medical facilities that we do. So our charge is much greater here in St. Clair, because we have a lot more people to inoculate with this vaccine, simply because we've got 3 hospitals and we've got a multitude of medical facilities and dentist offices, and that's why we're happy Sam is helping out, because she's got all the energy to take care of that.
Well, and as we say all the time, our first responders, those out there on the front lines, and when we say this thing is changing sometimes by the minute, by the hour, by the day, that's not exaggerating. Sam was running a little bit late to get here today because she was on conference calls with IDPH and other agencies, other health departments, everybody trying to work together to pull this big jigsaw puzzle together, because that's what it is. And as the chairman said, for 298 days, it seems like we're that broken record to keep telling you, the light is at the end of the tunnel, and it is. There are people that have got the vaccine here in the county. More shipments coming in tomorrow, I think you said. And we're following what CDC and IDPH has laid out.
And our state representatives were checking in with us today. I talked to Jay Hoffman and Representative Katie Stewart, about how we're doing and how the vaccines are coming, asking if they can provide any assistance. So we appreciate the state really honing in on St. Clair and trying to figure out how to help us.
And so the end result is like it is every day. The numbers are still too high. We have to get them down. Our regional positivity went down just a little bit, but the 7-day rolling is up. So please continue to spread the word. That's what we got to get. And I know we say it all the time. Please try not to get stressed out over it. We are, but we try not to because it's here. It's not going away. It's not that light switch that we can walk over and turn off. It's going to be here. So we're all in it together, and we will get through this together with everybody's help. So we'll be back with Cindy and Daisy in just a few moments to translate this into our Spanish community, and then we'll be back tomorrow for day 299.
One of the ways we can combat widespread infection is testing. It's been proven time and time again that many people who were infected with COVID-19 are asymptomatic, showing no signs of infection. They unknowingly spread the virus to those most vulnerable in our community. Working together with health departments in our region, free testing has been made available throughout the area, and we encourage all citizens and visitors to take advantage of this opportunity. To Team St. Clair and the rest of Region 4, if we work together, we can and will stop the spread of COVID-19.